Research shows that members of the 2S LGBTQ+ community are also disproportionately affected with lower screening rates.
One thing that kind of sticks with me is when I've been in healthcare spaces as a patient, not with direct cancer experience, but screening, for instance, and I've tried to fill in the intake form, and there isn't like a checklist or a box on that form that represents me, and I've had to ask questions that have made me feel really vulnerable, and all it takes is improving that form to make me feel seen. And being queer in a healthcare space is complicated and vulnerable, and we need to do the work to make it easier for people.
When people enter the healthcare system, it's very kind of cis and heteronormative. So, for example, relationships are often misidentified, and it just adds this kind of extra layer of difficulty at a time when people are already going through something that's very emotionally challenging and physically challenging, just harder to make themselves known. Being queer, trans, or non-binary is just one element of somebody's identity, and you have compounding experiences of oppression. So you're not only experiencing homophobia or transphobia, you might experience racism at the same time, or any other kind of ism in the healthcare system.
I think it speaks to the fact that it's much harder to exist with intersecting identities in a cancer environment, and maybe less willing, less able to share stories because of it's more complicated. And if you're not seeing yourself represented in stories, you're less likely to maybe be able to share your own story.
Kamiko Tobimatsu, a young, queer, and mixed-race woman, decided to push back and share her own story through unconventional means, a graphic memoir.
The most common images that we see, and it's getting a bit better, but the most common images are those of middle-aged white women in, getting breast cancer, and kind of traditionally feminine women, which, of course, that's a demographic of people who get cancer and breast cancer, but it's one of the many demographics. And so I think for those of us who don't fit that model, it can feel isolating that we're not seeing ourselves reflected. When it comes to reproductive cancers, like breast cancer, when it's tied to what we conceive of as gender and gender performance, that really comes alive, maybe more than other types of cancers. We really wanted to tell a different type of cancer story, a different type of health story, with the hopes that it will encourage other folks to think about their own experiences and put that out there so that we can have a much greater diversity of health stories that are out there and that are, reflect the variety of Canadian experiences.
Katherine Cheng, Global News.